Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Now, several European countries have brought in tough measures to punish parents who refuse to vaccinate their children following a measles epidemic, which has seen thousands infected and caused at least 35 deaths. Germany is imposing fines of more than £2,000, whilst in Italy, unvaccinated children will be banned from state schools. And in France, parents will be legally required to vaccinate their children from next year. Here in the UK, parents are encouraged to immunise their children, but the final decision is up to them. And while immunisation rates here are higher than much of the continent, including for the measles, mumps and rubella or MMR vaccine, take-up has been gradually declining in recent years and is lower than the target of 95% in some parts of the UK. One mother, Jo Walton, whose daughter Sarah was left seriously disabled when the measles virus returned 24 years after her initial childhood infection, told us why she feels the government should consider penalties against parents who choose not to vaccinate their children.
From the moment she arrived in the middle of a snowstorm, she was a beautiful child. She created sunshine around about her. She went to see her GP. She went through the fact that she felt as if she was behaving like she'd had a stroke. And then she finished off the consultation by saying, and I keep bursting into tears all the time. So the GP diagnosed her as being depressed and gave her antidepressants. By the end of November, she'd lost her ability to talk and to move and to eat. It's terminal. There's no treatment for it. You don't bring your children into the world for this. I feel as if I've cheated her because I should have known more when she was a child. I should have known to protect her against measles and I didn't. Measles isn't this benevolent childhood illness that everybody gets over, but it's actually an evil, cruel, devastating illness, which even when you think you've got past it, can come back and bite you. Years later, we can vaccinate it out of existence. Why aren't we doing it? I feel so strongly about it now that I feel that if parents decide that they aren't going to vaccinate their children, then there has to be a consequence to that action. Perhaps, as with being fined for taking your children out of school during term time, maybe there's a place for fining those parents who do not have their children vaccinated before they start school. There's nothing I can do. It doesn't matter how hard I work, how hard I love her. I can't make this thing go away. All I can do is look after her. And I will. I'll look after her whilst ever there's breath in my body. But I wish I didn't have to. Because she should be out there having a life.
Well, the BMA is calling for evidence to be submitted to the UK government on the potential advantages and disadvantage of childhood immunisation made mandatory under the law. It is a contentious policy, but should the UK consider compulsory vaccination? We can speak now to Lottie Daly, who's got 2 children, aged 3 and 5, and hasn't given her second child any vaccinations. Lacey Haynes, who has a 7-month-old daughter called Fox. Lacey hasn't given Fox any vaccinations and hasn't decided whether she will going forwards. Dr. Heidi Larson is from the London School of Hygiene and Tropical Medicine. She's a professor of anthropology and director of the Vaccine Confidence Project. And also Shirley Kramer, who is the chief executive of the Royal Society for Public Health. Thank you all for coming in to speak to us. Lottie, I want to start by speaking to you. We watched that film and it's utterly heartbreaking to see what can happen if you contract measles and haven't had a vaccine. Why did you decide not to vaccinate your second child when you had vaccinated your first?
Okay, well, I think there are thousands more cases of children being injured to that extent and more, and even death when it comes to vaccination that we don't know about, and the information just isn't there. So for me, I am not anti-vax. I went along and did everything that I was told to do, but when my daughter had an adverse reaction and nearly died following her immunisations, we ended up in intensive care for over a week. But I had to fight for quite a couple of weeks to get doctors to listen that it was indeed whooping cough that she had following her triple vaccine in both legs. She had 2 and they were quite late on.
Lottie, it's always heartbreaking, isn't it, when you hear cases of people who have had adverse reaction to vaccines, yeah. and people would always have sympathy with that. But the reality of the situation is Public Health England, the NHS, the World Health Organisation, all leading medical experts say that vaccinating your children is safe and it's the responsible thing to do.
Well, yeah, I think that's easy to say when you're not a victim of a vaccine injury with a child who's got a vaccine injury and you've got no accountability to get support for that child. I mean, for example, the Vaccine Injury Compensation Fund is exempt for children under 2, whereas most vaccinations are given to children under the age of 2. Yet if they were to be injured or indeed die, there is nowhere for those parents to go because compensation is exempt for children under that age. So
OK, Lottie, well, let's just kind of sort of fact check, if you like, some of the things that you're saying, because obviously it's a hugely emotive issue here, and people do worry very much about, you've got your vulnerable little baby, I've been there, they look at you sort of stroke their arm, somebody shoves something in their arm, they scream, they look at you as how could you do that, mummy? But the reality is that children must be vaccinated, Dr. Larson.
Well, I think we have enough evidence and lives saved for years. Globally, we've had really millions of children's lives saved. But I do appreciate that there's, from a public health perspective, we look at this in the big numbers, and there are a lot of personal experiences. Unfortunately, there's a lot of misinformation out there. When somebody reports an adverse event, that doesn't mean it was necessarily caused by the vaccine. These events are reported because they happen about the same time as the vaccine, and they need to be investigated. And I think we need to do better in clarifying which of these reported suspected events are actually caused by the event, because they're causing a lot of confusion in the public.
Lacey, do you feel confused? Do you feel like you're not getting enough information and that's why you've decided so far not to vaccinate your baby?
I feel skeptical overall of saying that something is completely safe. You walk into a GP's surgery and you're told by someone who perhaps hasn't even had education to know exactly what is in vaccines. They haven't read the peer-reviewed studies. They don't know all of the information. They're telling you within 5 minutes, yeah, this is safe, but there's a whole other story, as Lottie's pointing to. There's a whole other grey area. And if you want to have trust in that system, then that needs to be provided as well. There needs to be all of the information so that parents can...
So you want evidence? You feel that parents should be given evidence to see it?
Evidence, yes, but also to not just say the words, this is safe, because that isn't true. That is not true.
But it is true, isn't it, Shirley Kramer? I mean, there's evidence out there that vaccines are safe.
There's a lot of evidence. Certainly the science is very clear that we need herd immunity. So we need 95% of coverage of all our children to make sure that we have population coverage. And so why I say that is that it is about your individual child, and I absolutely understand when you look at your baby, you want to do the best for your baby and you're concerned about it. But actually, it's about your child and the children around your child. So, for example, in Sweden, they're very clear about their community responsibility. So if you have a vulnerable child, say with leukemia or some other illness, you want every other child to be vaccinated so that that child, you know, doesn't die or get more ill. So there are really good reasons. But to take up Lacey's point, I think that we need to do better in talking to parents and having those individual one-to-one conversations. We've seen that health visitor numbers, for example, are going down, and I think health visitors are really important, and practice nurses and others in primary care really answering the questions that you might have about vaccinations and their safety, because parents get fearful, and you know, we need to make sure the questions are answered.
What about this European model of actually penalising parents who decide not to vaccinate?
Well, I think that that legislation is made to protect the public, because I think also these are compulsory vaccinations to be able to go to school. And I think for the sake of the other children in classrooms, and for children, for instance, who might have leukemia or might have other immune-compromised illnesses who can't vaccinate, and to take Lacey's point, I would never say that vaccines are 100% safe. I don't think anything's 100% safe, but the nature of the reactions are mostly redness and swelling, and for certain individuals who have underlying conditions, they shouldn't be vaccinated, and that's like a child with leukemia, or that's why you have medical exemptions in a number of countries. But I think that some of these, all of these legislations have come up in France, in Italy, in Germany, in Australia. They've only come up in the context of declining immunization coverage, outbreaks, and there was 35, now there's 40 measles deaths in Europe in the last year that are totally unnecessary. We have one of the oldest, most proven vaccines that exists.
Can I ask you though, so we have the short-term side effects, redness, swelling, flu, but what about the long-term side effects that perhaps aren't being linked? You know, we have IBS on the rise, we have anxiety on the rise, we have all of these illnesses on the rise, like the report card, the health report card of children right now, but I think we're not getting sick with those illnesses.
The bottom line is the medical evidence is there, as I've said already, you know, whether it's the World Health Organization, whether it's Public Health England, whether it's the NHS, saying that the medical evidence is there, that vaccines are safe, and we've already seen the film there from Joe.
That's so short-sighted, it's so short-sighted.
But it's not, but it's just the reality, whether you like it or not, that is what the
but it's not,
what's
as Dr. Huddy just
what's
said.
more interesting to look at here is whether we are going to increase the number of parents vaccinating their children through a carrot or a stick. So penalising them and saying you can't go to school, or we're going to fine you. Is that going to work? Or is it about talking to the likes of Lacey and saying, this is safe?
Perhaps we need a two-stage process. So I would first say that we absolutely need to do more talking to parents and more explanation and more discussions really about the negative. I think anybody seeing Joe's story this morning will have not really realised that that's a potential with measles. And so it isn't just about those 40 deaths in Europe, it's the number of children that will have serious complications. There were 3,000 outbreaks in Italy in the first 5 months of the year. In the UK there are only 27 in that period of time. So we are protecting our children, and most people want to protect young people.
But I do also take the point that these rising other issues coming up, but the tendency is to link it to vaccination because all children have had vaccination, when in fact there are so many other things that could be contributing to autism, to IBS, to these other, the number of things, additives, environmental things, other issues that have come up in our society, in the world. We're using all kinds of new chemical and other products and foods and other things. We need to understand what is contributing. And when I've been asked about the MMR autism thing, I said the only way we're going to appease parents in their anxieties about these other things are find out what's causing them. I mean, with HPV now, we're looking a lot at, we have groups of girls who are having fainting, chronic pain, fatigue, that they're linking it to vaccination, but when we look at these symptoms in the broader population of adolescent girls, they're all having them, whether they're vaccinated or not. I mean, not all, but the rates, the percentage of girls having these symptoms are the same. Something else is going on that we need to understand.
And there aren't, I don't think there are any studies, though, that show the two sides, the vaccinated children, the non-vaccinated children, and what the long-term fallout
It's worth
is.
saying, and you raised there, Dr. Larson, about the MMR vaccine and autism. Of course, that was Dr. Andrew Wakefield. He was struck off. It was a disproved theory. It was completely discredited.
I know, but there are still parents who have won lawsuits in Italy and the US.
Parents might be worried about it, but the science is such. The science is convincing that says that this is safe, and it is safe to vaccinate your children. I have to say, lots of people getting in touch this morning, Julie on Facebook, saying, why wouldn't you vaccinate your child? Illnesses have been eradicated because of vaccination. And Margaret on Facebook says, one of my daughters had the measles injection and started having convulsions within 48 hours, then still had measles 3 years later. But Thomas says it's child abuse and should be treated as such if you don't vaccinate your child. Lots of people getting in touch. Thank you all for coming in this morning to talk about that.